If you suffer an injury, how can you know whether or not you need surgery? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Now this is tricky. I get this a lot from patients in my practice who don't go see the doctor right away because they think, well, it's not going to be something real serious, probably doesn't require any kind of surgery, so I'll just wait and see if it gets better. And I don't know that there's one particular thing that you're going to look for that says that needs surgery. But there's kind of general categories that you might look for to have a clue that surgery may be in your future. Few obvious ones. Let's start with, the bone or joint is out of place. Your shoulder popped out of place, or maybe your kneecap popped out of place, or the bone is crooked if it's your leg or if it's your forearm. A lot of those, maybe not all, but a lot of those might need surgery, and maybe sooner rather than later. So maybe you go to an emergency room and get that checked out and get it dealt with. Could be something else that you can't bear weight on it, or your knee's locked in a certain position, or you can't lift your arm at all because pain obviously, but it's extremely weak. Something like that might be a good indication to get an appointment with an orthopedic surgeon within a day or two of the injury, find out what's going on, by physical exam, getting x-rays, maybe even getting an MRI to find out if this is something that you need surgery for, and if so, when. There are some injuries, and there's tons of these, not just the ones I'm going to mention, but say like biceps tendon ruptures at the elbow, patella tendon tears down below your knee, and so many others that are really hard to treat if you don't do the surgery within the first couple of weeks. So some of those types of things, if you can't lift your leg, you can't lift your arm, something just doesn't seem right, you're worried about it, go get it checked out, because potentially if you're going to do surgery, you'd want to do it fairly quickly. The other sort of list of situations where you might end up needing surgery would be nothing else is working. Whatever your injury is, be it your foot or your ankle or your knee or your shoulder, maybe you've tried rest and modifying the activities that bother it. Maybe you've tried anti-inflammatory medications or cortisone shots or PRP or stem cells. You've tried physical therapy, taping, all sorts of other treatments, and you're not getting better. Sometimes then you just say, hey, look, at some point, you go in and fix the damage. If it's in what I do, sports medicine, hopefully that's arthroscopic surgery, where you go in the joint through 2 or 3 little poke holes and see all around it with a camera, take care of the problem. Other parts of the body, it may be a longer incision, but it's worth talking to your doctor about. I get patients all the time that come in and I ask them, so how long's your shoulder been hurting, or how long's your knee been hurting? And yeah, I'll get some that say it just happened yesterday or a few days ago. But you'd be surprised how many I get that say, I got hurt 2 years ago or 5 years ago. And you think, well, why didn't you come get it seen sooner? And they make some comment about, well, I didn't think it was a big deal, so I just waited to see if it would get better. Then I finally realized it's just not getting better. So if you can't do what you want to do as well as you want to do it, it can be a good idea to get it checked out, even if you find out that you don't need surgery. Okay, I hope that was helpful. Now, I would love to know the number one challenge that you face with your injury, whether that's something that needs surgery or not. In the description below this video, there's a link at the very top that will take you to a page on my website, and you can write and type as much as you want about the injury and the challenges that it gives you. That information is so helpful to me so that I understand what you're going through, and I can create more articles, videos, webinars, ebooks, courses, things that can really help you get better, understand what you need to overcome your injury. If you like videos like this, I record several of these videos every single week. Plus I do live videos, Ask Dr. Geier Live, and you'll be notified about all of those videos if you subscribe to my YouTube channel. So click the subscribe button in the upper right corner of the page. Thank you so much for watching, and I look forward to seeing you in our next Ask Dr. Geier video.